Just imagine we could understand what's wrong with our bodies by actually looking inside them.
Wow, that is something. That's amazing.
This series is all about helping families who, just like mine, are trying to get to grips with health challenges.
It's always there in the back of your mind.
It takes away your happiness.
I just want to know the truth about what's happening in my body.
By bringing people together with state-of-the-art technology, let's flip the visors down on our headsets. We'll let them literally see beneath their own skin.
So let's peel away the bones. Wow, look at that.
Gosh, I have never seen anything like this.
Is that my prostate? It's like a big haggis.
It's just really incredible to see inside me.
Working with the country's top doctors, they'll have a medical consultation that will truly astonish.
So you can see the healthy uterus here, and this is yours.
Just to say, these are your breasts. Helping them to not only understand their condition.
That is what's causing your pain.
Oh, really? Oh, Trudy, that looks startlingly different, doesn't it? But also make the key treatment decisions they need to get better.
What we'll be doing is removing all of the left lobe.
You can see it's shrunk right down to almost nothing.
Now I can see it for what it is, and I want to get it removed, and I want to be better.
Oh, bless you.
I'll be there for every step.
How's my brain?
As we use the power of technology.
You're incredible.
To bring hope to our lives.
Knife, please.
I will never see life in the same way again.
So thankful for the care that you and your medical team, without you, I wouldn't be here today.
This is your health as you've never seen it before.
Quite handsome, isn't he?
Having a serious health condition is terrifying, and having someone you love with a serious health condition can be just as daunting. When my husband Derek was diagnosed with COVID-19, it turned our lives upside down. And that fear was made even harder to bear because I didn't understand what was going on inside his body. So we're bringing patients and their doctors together in our unique imaging centres, where they have a mind-blowing consultation that helps them get to grips with their condition from the inside out. With the help of consultant Dr. Guddi Singh,
So let's have a look at the scan, shall we?
they'll get the ultimate insight into what's really going on inside their body.
With the latest technology and augmented reality, we're going to show you your body in a way that you've never seen it before.
The first patient to one of our imaging centres is 40-year-old fashion influencer Hilda from London, who's come along with her best friend.
I love clothes. I think they're beautiful. It's so cute. With endless possibilities, you can be whoever you want to be in whatever outfit you choose to wear. Oh, I love this.
Hilda and best friend Lua have shared a love of fashion since being teenagers.
Oh my God. There was a year that we went to all the parties, didn't we?
Yeah. We skipped classes for the parties. You know, we were always, wearing mini skirts. Always looking for the next outfit and the next tickets to the next event to go to. Those were the best years of our lives.
But Hilda has been hiding under her clothes a growing and painful problem in her abdomen, which has dramatically worsened in the last few months.
Recently, my tummy has just gotten bigger. It's been really hard.
She's been referred to the care of Mr. Stephen Quinn, a consultant gynaecologist at St Mary's Hospital in London.
This is a very extreme case, isn't it?
It is, yes. And we would see a case like this maybe once or twice a year.
The frightening escalation in Hilda's symptoms means action is now required.
I want to be able to see inside myself to better understand what's going on, where the pain is coming from. And I'm just hoping that there would be a long-term solution for this condition.
Thank you. Thank you.
So here we are.
She's about to confront the source of all her anguish. Aha!
Hi, Kate.
Lovely to meet you. Take a few, sit down.
Thank you.
Lovely. So you must be Hilda.
I am Hilda.
And you're Lua.
Yes, I am Lua.
Best friends.
Forever.
Forever. I like that. I mean, I can tell straight away that you love clothes. You are in fashion and you look amazing and you're disguising it, but your tummy is very distended, isn't it?
Yeah.
Can you sort of show us a little bit?
Yep, it's there. So that's why I try to go for outfits that, you know, are kind of loose. I'm always trying to mask it.
What is this condition?
I was diagnosed with fibroids.
Fibroids are the most common gynecological condition in the UK, affecting up to 40% of women of reproductive age. Fibroids are non-cancerous growths that form in and around the womb or uterus, and for most women, symptoms will be mild or even non-existent. But in extreme cases, they can cause severe pain, heavy bleeding, even infertility, and sometimes a bulging tummy, all of which are affecting Hilda. Now, you are going to have an emotional moment, I suspect, because you know that you're going to be seeing inside that bump that you're constantly trying to hide.
Yeah.
And seeing what's causing it. How do you think you'll feel when you come face to face with that?
Honestly, I'm ready for it. I cannot wait, you know, come face to face with fibroids and just tell them to leave my body and never return.
Lua, what do you want to come out of today for your friend?
I'm not asking for too much, but for somebody who in a month has only like 7-8 days where she's her bubbly self, I just want a bit of normalcy for her.
Well, look, let's hope today you get a chance to see a solution and a way forward. Taking Hilda through for her consultation is Dr. Guddi.
Lovely to meet you.
Lovely to meet you, Dr. Guddi.
Do you want to come with me then?
Sure. Thank you.
Today's a chance for Mr. Quinn to not only explain to Hilda exactly what is going on in her abdomen, but also outline a potential treatment that could help her.
So this is a fantastic opportunity. What I'm really hoping today with this three-dimensional imaging is to get a much clearer idea of exactly what's going on in the pelvis. Hopefully give some reassurance that her symptoms will get better.
Hi, Stephen.
Hello, Mr. Quinn.
Hello, Hilda. Lovely to see you.
Lovely to see you too.
Now, what we have here are your scans, and we want to be able to show you in more detail what's happening inside your body, and not just in 2 dimensions, but in 3 dimensions. Now, how do you feel about seeing that?
I'm excited. I'm hoping this would be a great opportunity for me to also understand what's inside my body.
Right then, I think we should do it.
Okay,
Let's go.
The key organs in Hilda's MRI scan have been transformed into incredible 3D augmented reality. So what she sees is actually her own insides. I'll be next door with Lua, watching as Hilda comes face to face with her fibroids for the very first time. Do you think this is going to be quite hard for her?
It is going to be hard. I actually feel like I'm shaking.
Do you?
Suddenly, yeah.
Right, let's put the headsets on then.
Oh, Lord. That's unbelievable.
This is your body.
Yeah.
So this is how your abdomen's currently coming out. You can actually see your belly button.
I can
here.
see that now, yeah.
Just there.
Does this kind of feel like your body? Because
It does indeed, because, you know, I've got that protruding belly, and that looks exactly like me.
Yes.
That's scary, but very interesting.
You look at that, you can see the burden
Yeah.
in every sense she's been carrying.
I want her to know what she's carrying, because we call it a monster, because it feels like she's been pregnant for a long time without actually having a baby.
For Hilda to find out exactly what's causing her swollen abdomen, she needs to take a closer look at her uterus, as this is the organ where fibroids develop. But first, Mr. Quinn wants to show Hilda what a healthy uterus looks like.
So Hilda, what we can see here is a uterus inside the pelvis. So this is a normal-sized uterus. So that's the sort of space that a uterus would normally occupy.
I think what is interesting here is if you look at it, the uterus is really low down in the pelvis. It just sits very kind of tucked in and away and out the way. Now, I would like to show you what your uterus looks like. And I know that you're really keen to see it.
Yeah.
But it might be difficult for you to see this next image, so I want you to be prepared and ready for it. And I'm going to show you your uterus here, just next to the other one, so you can see what they look like side by side. Yeah?
Let's go for it.
Yeah? Okay, then.
That's scary.
So Hilda, what we're seeing here is your uterus. So you can see it's unfortunately extending well outside the bones of the pelvis.
Oh my God.
It's terrifying, isn't it?
Those real images.
Those are real images.
When compared to a healthy example, Hilda's uterus is 40 times the size and taking up most of her lower abdomen, similar to carrying a full-term pregnancy.
I can see from your reaction that it's a bit of a shock.
This is very shocking.
What are you thinking right now?
You know, the graphic reality of what is sitting inside my belly is shocking. Having seen the normal one and compare, it's like an inflated balloon. It's enormous. It's too big. I wasn't expecting it to be that big. That's scary.
I'm sorry, I know this is a lot to take in.
Yeah, I'm fine. Oh, bless you. Thank you.
How did he get to that point?
Do you think she's all right?
I don't even know how she's
coping with it.
I did not expect anything like this.
Yeah.
So painful.
It's created a lot of negative impact in the way I live my life. It's kind of taken away my self-confidence in a way. And that means I've kind of limited how much I interact with people, you know, where I go to and who I want to be around. It just takes away your youth. It takes away your social life. It takes away your happiness in a way because it kind of prevents you from doing most of the things that you really want to do.
It's hard for best friend Lua too, who's seen Hilda struggle every month with increasing abdominal pain and heavy bleeding.
I knew because we were close that she had times in the month that she'll be in pain.
But at the time, we didn't know what it was. All they said was, it's just painful periods.
Hilda received her fibroids diagnosis a number of years ago. While the monthly pain and bleeding were manageable for a while, recently her situation has worsened, along with a dramatic change in the size of her belly.
Each time I meet new people, I always get the, oh, congratulations, wow, you're glowing, or when is baby coming, things like that, which is incredibly stressful. When I look at this picture, I feel sad inside. Cannot wait to just wear a little dress and not worry about my tummy bulging out.
Unlike most women who only experience mild symptoms, Hilda's fibroids are causing significant distress and pushing her belly outwards. At our imaging centre, the doctors want to help her understand exactly why.
Let's put the headsets on again. Come and walk with me and just have a look at it from all sides and just see exactly what's going on here at the back.
Taking away Hilda's healthy uterus tissue reveals just what's causing it to be so enlarged and misshapen.
Stephen, can you just tell us what we're looking at?
So Hilda, this is what's been causing that enlargement of the whole womb. You can see that large fibroid there separately at the top, and that's just sitting there. Again, you can see each one of these individual fibroids sitting on the outer portion of your womb. And then within the uterus, you can see these smaller fibroids inside.
Ball-shaped benign tumours or fibroids are growing throughout Hilda's uterus, on the surface and inside, stretching and deforming it to a huge size.
There's a lot of big ones.
Oh my goodness.
Maybe you can just show me on your own tummy, actually. Where do you feel the fibroid?
I feel, you see the one at the top, it's one big fibroid, but there's one on the side, there's one at the top, and there is another big one, my lower abdomen.
And so you can feel all of that in there, can't you? Yeah.
This one, I feel it all the time sitting there, and the one on the side.
And that's this one up here at the top, which you're feeling. And then at the front, yes, you can feel these other ones. And Hilda, if you come round and just have a look from the side, you can again see how this would be pressing on the front of your abdomen.
How do you explain how it got to this level?
That's a very good question. We don't completely understand as yet why fibroids grow. There are a lot of theories about that. We know that fibroid growth is related to estrogen, and that's one of your main female hormones that drives the growth of these. Some individuals are more susceptible to fibroids, so sometimes there can be a family history of these types of fibroids within the womb.
As well as a hereditary link, fibroids appear to be more common in women early to start puberty or who haven't had children. During menopause, the drop in hormone levels may cause existing fibroids to shrink.
Stephen, to me, it looks like there's a huge number of fibroids in here. I mean, how many do we think Hilda has?
We believe that there are just over 90 fibroids in total.
And that sounds like a lot to me. How much would you say is normal for a woman who has fibroids?
So most of the women I see with fibroids may have 5, sometimes 10 fibroids. So this really is an awful lot to have inside the womb.
Hilda's case is extremely rare. Of women who do have fibroids, just 1/3 will suffer from any symptoms. But if you are worried, always consult your GP.
That's unbelievable. And it's just all over the place.
It's unfathomable, isn't it?
This is one of the most challenging examples of fibroids Mr. Quinn has ever dealt with. The big question remains, what on earth can be done about it? Can they actually even be removed?
With cases like this, it becomes much more complex, where there are very many fibroids, and the size of those fibroids has enlarged the uterus to really a very significant size.
Oh my God, it's a monster.
When you're living with pain like Hilda, it's all-consuming. We've all experienced pain at some point in our lives, and you know, we Brits spent £660 million on over-the-counter pain relief in 2020 alone. Are we, though, spending our money wisely? Dr. Karan Rajan has the lowdown.
Here's a secret about your health that no one ever tells you, and it's going to save you a lot of money. The cheaper generic painkillers is just as good as the more expensive fancy branded painkillers. Say, for example, someone punches me in the face. That doesn't happen very often, but if it did, I'd be very upset. You get the expensive stuff that says it can work on your headache, it can work on your period pains, it can work on your backache, right? But it doesn't focus on that specific area. It goes through your bloodstream and just finds where the prostaglandin is and where it can reduce it. But what about when they say it's faster acting? Does that hold true? So it's not all a big marketing ploy. Fast acting is an actual thing. In order to justify the claim of fast acting, a drug has to have its onset of action within 30 minutes of oral administration. But Generic companies and generic painkillers actually have a fast-acting counterpart as well, and they also have to meet the industry standard and the brand leader and have the same onset of action time. So, spread the secret to all your friends and save some pennies before Big Pharma come and take me away.
Today, we're taking our technology to help 50-year-old Trudy, who's been suffering from severe pain in her shoulder.
Trudy!
Hi.
Oh, lovely to meet you.
And you.
We're meeting at one of our imaging centres where we use our kit to dive deeper into the cause of her painful symptoms.
How are you doing this morning?
A little bit sore, but yeah, okay.
So where are we talking about this pain's coming from?
It's in my left shoulder and it goes right up into my neck, and that's where it's excruciating pain. It's right from the base, top of the neck, right the way down my shoulder.
So if you tried to, I don't want to put you in pain, but if you tried to stretch your left arm out a bit, how far can you take it?
This is as far as it goes out. That's as far away from my body that I can actually get my arm, and it's actually hurting at that point.
Oh.
Okay, off we go.
Mother of 3 boys, Trudy lives in West London with her long-term partner and 12-year-old granddaughter.
I am an extremely family person. I spend as much time as I possibly can with my boys and my grandchildren, and try and do as much as I possibly can with them. They keep me young and fit. Can you pick that one up for me, Nicole? I can't reach that one, Mark. Could you pick up the bran flakes for me again, please, darling? Thanks ever so much for your help.
Trudy currently works as a receptionist, but the recent lack of movement and pain in her arm has forced her to take time off.
Can you just pick that one up for me, sweetheart? I can't reach that one either. Thank you. So about 4 or 5 months ago, I started with this niggly pain in my left upper shoulder. I started getting stiff, and then I found myself after several weeks not being able to actually move my arm. To actually move my arm out like that, just away from my body, is really painful. And then I can move the bottom part of my arm okay, but it's just too painful to try and move it any other way. I've not been able to do a lot of things. The basic things of being able to get dressed, undressed, sleeping. It always hurts. Some days it's excruciating. So if you can get me out the dish from under here for me. I like to look after my family, so for me to not be able to do it on my own and having to have help is very frustrating. OK, can you open that for me, darling, please?
For my mum to ask for help, it must be pretty severe, to be honest. She's also a really independent person, so seeing her how she is now, it's kind of taking a massive step back.
A scan has revealed Trudy has a frozen shoulder, a common joint complaint that 1 in 20 of us will suffer from in our lifetime. It occurs when tissue that holds the shoulder joint in place becomes inflamed. It can develop quickly and cause increasing pain, stiffness, and sometimes complete immobility.
I don't actually understand what a frozen shoulder is. Hopefully seeing my problem, it'll help me understand what it is that's actually wrong with me, not just a name of something, but an actual physical image of what it is. I'm just hoping that a cure or something can happen so I can actually move my arm again. I don't know how long I can actually put up with the pain.
Dr. Dimitri Amiras is a musculoskeletal consultant radiologist at Imperial College Healthcare NHS Trust. I'm hoping he can give Trudy the answers she desperately needs and offer a treatment that will get her back to her old self.
All I want to know is what I can do to help myself and just where I go from here.
Hello.
Hi.
Hi, Trudy. I'm one of the radiologists here. I've looked at your scans, and I think it'd be really good if you came through and we can have a look at them together.
Yes, please.
Fantastic.
Can I come too?
Of course you can.
Thank you very much. Trudy, after you.
Thank you.
Trudy's own scans have been combined so she can see her shoulder in 3D and get up close to the source of all that pain. It does mean that you have to put these silly glasses on.
That's
but they're
fine.
very clever silly glasses. So let's pop them on.
Okay.
And see what we can see.
Oh, wow.
Excellent. I'm seeing a skeleton.
I'm going to make it a bit bigger so we can see it a little bit better. Look at that.
Oh, wow, that's
Okay.
better. Oh, gosh.
So what we've done is we've put the scans of Trudy's shoulder here, and you can see Trudy's shoulder. This is actually your shoulder from your scan.
Oh, wow.
This bit here, this is the clavicle. This is your collarbone.
Right,
You
yeah.
feel across the top of your chest. And then at the back, you've got your shoulder blade, so you
Yeah.
can almost feel the blade at the back sometimes. And then this is your humerus, the long shaft down there.
So this is the long bit of the arm down
Yeah,
here.
exactly.
These images are the key bits of the jigsaw that make up Trudy's shoulder. Can you see that, Trudy? Have
I
a little
can.
look.
It's just really incredible to see inside me. It's
There you
breathtaking,
go.
actually.
Straight, isn't it?
You can turn around and have a look if you want.
Oh, can you?
Yeah, walk around it, yeah. have a
Yeah, it
look.
doesn't disappear.
Yeah, do you see your shoulder blade
Oh,
there
my
at the back?
gosh. Oh, that's really incredible.
So this is what your shoulder should be moving like.
Wow.
That's incredible.
So you can see, can't you? It is literally like the end of it is a ball moving in a sort of cup. The shoulder joint is where the end of the upper arm bone fits into a pocket, creating a ball and socket joint. This incredibly flexible joint allows us to move our shoulder in a full circle.
Now, because it's such a mobile joint, it allows us to do lots of things, like lift our arms up and touch the ceiling, wave at people, throw spears, throw rocks.
All the things that Trudy can't do, basically.
Yeah, exactly.
And you, Trudy?
I can't do any of them, definitely not.
I know. You're rubbing it in, Dimitri.
I'm sorry.
Rubbing it in. Most of us take our shoulders' flexibility for granted, and Trudy's desperate to find out what's caused hers to seize up.
What is it that's stopping me from being able to move my shoulder and have got all that pain? It's all across and then down. So
Do you want to show us on the
see?
model?
Yeah, so I'm actually getting pain across the top
Yeah.
and then down this part here and then around the back.
Yeah.
So that's the
whereabouts
whole
around the
section.
back?
So if you go around from here, it's all around this part of the back here, and then up into my neck. So and then down here along the arm.
To show Trudy where her pain's coming from, we need to add in some of the soft tissue to the bony joint. Let's have a look, Dimitri.
So we have the capsule,
Okay.
which we can show you.
The capsule covers the shoulder joint to stop the arm bone from popping out of the socket and contains fluid to help lubricate the joint. So where is the capsule, Dimitri?
Yeah, sure. So the capsule is this structure here. So
Right.
it's this big white structure on the outside.
Okay.
It'll stop you popping out, but it won't stop you moving your arm.
Right.
So this is actually a normal capsule.
Right.
It's got a baggy bit at the bottom.
Yeah.
And that allows you to move the shoulder like this. It's like a set of baggy trousers that will move with you and move around.
Can't be the baggy pants. Can't be the baggy pants.
But if we're going to have a look at what your capsule looks like in your case.
All right, okay.
So yeah, so we've got what you should have here, and then this is what, unfortunately, this is your capsule that we've made from your scans.
Oh, Trudy, that looks startlingly different, doesn't it?
Yeah, very, very different.
Yeah.
Very red and angry.
Yeah.
It's like a piece of bubble gum all stuck together, and it's solid.
So I'm going to move your shoulder now
All right.
on your digital self.
You feel sick, don't you, at the thought of it? It's only on this.
Yeah.
It's only on
A hot sweat just thinking about it. Oh, gosh.
So just by looking at how you've been moving it, I think you'd probably only be able to get up to about here
Yeah, that's
before
that's
that
as far as
capsule
I...
starts
Yeah.
really pulling and being tight.
Oh, it's making me feel queasy.
It's actually Like the thought of it's just so painful. No.
Yeah, so that's probably as far as you can get when you're really pushing it.
If I really pushed it, yeah.
We talked about the baggy trousers before, but these are a very thick set of tight trousers. And you know, when you wear tight trousers, you can't really move around too much.
That's my shoulder.
And what we have seen is that in these cases, there are more blood vessels. And with those blood vessels, there come small nerve fibres. And those nerve fibres give you the pain that's keeping you up at night.
Right.
Why are there so many blood vessels in it? What's gone wrong?
What's happened in your case is you may have had a small injury you're not aware of, and it's triggered off this process. It's trying to heal. So there are healing cells in there that have kind of overhealed and it's kind of stiff. It's a bit like a scar tissue that's overdeveloped.
Oh, right, okay, yeah.
So in a way, the body's cure is actually ending up causing the problem.
Exactly, yeah.
It's trying to help, but actually it's gone too far.
Yeah.
With Trudy's capsule packed full of extra blood vessels to heal the area, there's little to no flexibility or room for the shoulder to move.
So I get the shooting pain coming right down into my arm, and that's excruciating.
So how do you feel at looking at that then?
Actually being able to see it on the image shows me exactly why I can't move it and what it is that's stopping me. So it helps me mentally to be able to cope with that. And to understand it a lot better.
Now that Trudy understands her condition, Dimitri wants to discuss a treatment.
So we have got some options, and one of the ones that works really well is an injection into the joint. We'll put a needle into your shoulder and inject a steroid.
This steroid injection will send messages to Trudy's capsule to tell it to stop making new blood vessels, creating scar tissue, or sending pain signals, therefore breaking the unnecessary healing cycle her body is stuck in.
And I can show you where the needle's going to go in if you want.
Yeah.
If you come around over here, I can show you. We take the needle at the back and we advance it through the skin, through the muscle, through the capsule into the joint space where that joint fluid is.
Okay.
And then we inject a steroid in the local anaesthetic. But it's when we get to this inflamed capsule that it is painful and it can be quite sore.
I love doctors. I love the way you use the phrase advance it.
Yes, yeah.
I mean, basically, you're going to have to stab through her skin a muscle to get in there.
The downside of this technique is that it comes with even more pain, so Trudy has a difficult decision to make: live with it or face the procedure head-on.
There's a lot of talk of pain there, even in the solution. You've got some big decisions to make, haven't you?
Yeah, I've been in pain for so long, though. I think it's a case of it's one evil over another. What's better and what's not. Seeing what the actual problem is has helped. I definitely need to have something done. And yeah, I think this is the right option, definitely. I just hope, you know, you can cure that, be my hero of pain to stop it.
I'll do my best.
Should I have a large glass of wine first?
Oh, no.
And you're definitely not.
I'm definitely not, yeah.
Not with that needle and how accurate that is.
We'll do that after.
Yes, exactly, yeah.
Fantastic. Looking forward to it, I think.
One of the best ways for the body to heal itself is by getting lots of quality sleep. But the evidence shows we're a nation of terrible sleepers. Here's Dr. Karan Rajan with some helpful advice.
A classic mistake I know you're guilty of doing, especially during lockdown and working from home, is bringing movies and TV shows into your bedroom. You're watching vampires, ghosts, demons, and zombies before you go to bed. That's going to raise your heart rate and raise your blood pressure and adrenaline and cortisol levels. These two are your stress hormones. You're going to be wired, you're going to be stressed. What your body needs is a state of relaxation. Your heart rate, your blood pressure, your adrenaline and cortisol levels all need to be winding down before you go to bed. That's what your circadian rhythm dictates, your internal body clock. So if you chronically do that, it's going to affect your sleep and you're going to feel knackered.
We're We're back in our imaging centre, where Hilda has seen her distended womb up close and discovered she has more than 90 fibroids in and around it.
You know, the graphic reality of what is sitting inside my belly is shocking. It's like an inflated balloon.
As well as causing pain and bleeding, the sheer size they're taking up in the abdomen is putting pressure on her organs, making her feel nauseous and her bladder constantly feeling full.
What we're going to do is have a bit of a closer look at the structure of the womb and the fibroids, and I think that will help sort of explain a lot of the symptoms that you've been getting.
It's impacted me in so many other ways. I'm constantly going in and out of the loo, so in the night, I'm always up. I don't get much sleep. It's become a lifestyle now, like that's all I know. To me, it's normal, but it's not normal. That's only because my life has kind of adjusted around the condition, which shouldn't be the case.
So at the moment, these fibroids that we can see on the outside of the womb are causing a lot of what we call the pressure symptoms. So Hilda, you can see the liver up here, which is being pushed up a little bit. And just underneath your womb down here, you can see your bladder just sitting underneath there. And I think a lot of the symptoms that you have related to your bladder are unfortunately being caused by the weight of your womb pressing down on your bladder, which means that your bladder's feeling a lot more full a lot earlier.
It's been compressed.
It's been compressed.
You know, a normal bladder can hold up to about a pint of fluid. Whereas your bladder probably only holds half of the amount of urine.
It's really difficult because I'm conscious of the fact that, you know, I'll spend most of the night or just being here running back and forth from the toilet. That really explains it. I can see there's a lot of difference.
Such a burden, isn't it?
It is.
So she can't even relax. Well, hopefully understanding that it's the pressure, I'm hoping this is going to be helpful.
Absolutely.
While Hilda's pressure symptoms are uncomfortable and frustrating, it's the monthly pain and bleeding that are the most debilitating of all.
It starts with, you know, a bit of discomfort in the belly, the lower abdomen, and it kind of spread. You know, sometimes it goes down to my knees, my ankles. I have like back pains. I am really restricted because when it's bad, I could be bleeding for about 3 weeks in a month.
You're dreading every period when it comes?
Every one of them. It's the heavy bleeding at work. I've had accidents in strange places, on the tube, just everywhere. And it's so...
It must be horrific.
I can't even describe that. I cannot put it into words.
Periods, heavy periods. A lot of women have to deal with, but to give us a sense of what she goes through, I mean, it's off the scale, isn't it?
Basically, she can't do anything. She can't move. She prefers to just stay in the toilet or just lie down, because when she gets up,
it comes.
She changes her mattress maybe every few months because it's old.
It's okay. Take your time. Take your time.
It's having to deal with challenges like that.
Right.
It means rather than just living and, you know, taking one day at a time, I spend my time focusing on the pain that's ahead of me.
Are you feeling like you're ready to go on?
Sure. Yeah, I'm good to go.
Okay.
Yeah.
Hilda's heavy bleeding is not only hard to manage, it's also leaving her with very low iron levels, making her feel exhausted. This time, it's the smaller fibroid growths inside Hilda's womb that are causing the problem.
So this is a view of your uterus, but a view sliced down the middle. So it's a cross-section of your uterus.
This shows it really well, Hilda. We can see, most importantly, I think, here on the inside of your womb. We look at all of this. And this is going to be having an effect, pushing the lining of your womb to a larger size.
Expanding it.
Expanding it. There's a greater surface area. There's a larger surface area that you're bleeding from each month, and that's causing a lot of the bleeding that you're having.
Is that what causes the pain, the monthly pain?
It'll certainly be contributing to that, yes. and you get a collection of blood inside the uterus that will then occasionally come out as really very heavy flooding, which is really difficult, horrible symptoms to have.
But it makes sense. It puts everything into perspective, like, you know, where the pain is coming from.
But at the same time, there is hope, isn't there? And there is a potential for treatment for Hilda.
Yes. The priority here is to give you relief from the symptoms, to get as many of these fibroids out and to try and make things better for you.
To treat Hilda, Mr. Stephen Quinn will carry out a procedure called a myomectomy, where the outer and inner layers of fibroids are surgically removed one by one and the womb repaired.
One of the big risks with this type of surgery, Hilda, is bleeding. So we have to be very careful. As we remove, first of all, the bigger fibroids and then the smaller fibroids, we have to really carefully control that bleeding as we go through the surgery.
If Mr. Quinn is unable to control the bleeding, he'll have no choice but to remove Hilda's womb. This is called a hysterectomy and would prevent her from ever getting pregnant in the future.
Come on, Elizabeth, let's do this. You can do it, Elizabeth. I know you're very good.
Hilda has 10 nieces and nephews and is so close to Lua's kids, they call her auntie.
Can you say your alphabet, Elizabeth?
But so far, Hilda has no children of her own.
One of the reasons that I'm doing this now is the hope to start a family soon. And I'm hoping that dream would come true once all of this is resolved. Then I can move into the next stage of my life, the next chapter, and start popping those babies.
A, apple. Apple.
She's just a natural. And when I watch her with the kids, it's mixed emotions. I'm happy that she loves them, and on the other hand, I keep thinking, I want same for her.
C for cat. Elizabeth, cat.
Long term, I want little Hildas. I want her to experience life fully.
While surgery does come with the risk of losing her womb, it's still Hilda's best chance if she wants to have children in the future.
We're trying to avoid hysterectomy, but I really want to try and avoid it if we can. So surgically, we're going to try and do this as carefully as we can to try and keep everything together.
It's incredibly clever what they do. And to understand what they're attempting to do, hopefully will make her realise there's also extraordinary hope.
Absolutely.
You know, in that.
I'm glad that we're here today. I'm glad that I'm going through this surgery. I'm ready for it. I'm mentally prepared for it. I'm glad that Mr. Quinn is looking after me, and I can only pray and wish for him the best in this.
And here she is now. Come here, you.
Thank you.
I think that was fantastic. Being able to see the anatomy in such detail and in 3 dimensions was absolutely wonderful. And I think for Hilda, that was very powerful, being able to literally visualise what's going on inside her own body.
It's been very emotional for us watching you, but you seem to get something from that.
I don't know what I was expecting when I walked through those doors. I was shocked at how my body looked inside. I did not expect that. That's one too many.
It should make you think how amazing you are to have dealt with that in the past.
Yeah.
And of course, the future is surgery that could liberate you from a lot of this pain.
Absolutely.
Do you feel more ready for that now?
I'm ready. I'm pumped for it. So this, to me, is the therapy that I needed.
Amazing.
I can't wait to fit into whatever dress I want to, you know, take pictures.
We'll talk to you afterwards.
Hopefully.
Hopefully with fewer tears and even bigger smiles.
Thank you.
"50-year-old grandmother Trudy is hoping for a life-changing solution to her frozen shoulder by going down the injection route.
If you come round over here, I can show you where the needle's going to go in if you want.
Yeah.
And we advance it
I just want to be able to sleep at night, be able to use my arm normally, and to be pain-free, to be honest.
In the hope of giving Trudy back mobility in her shoulder that's been stuck in place and causing terrible pain, she'll undergo a series of steroid injections at St Mary's Hospital in London.
Whenever you're ready, lie on your right-hand side.
That should reduce the inflammation and loosen the joint.
What is it they say? Imagine yourself on a beach. Where's your happy place?
Seeing the 3D image of my shoulder really did help me in my own mind be able to visualise it and, you know, help me cope with what I'm actually going through at the moment, and knowing that if I didn't do anything, the pain would continue, and it was at a point that I either choose this or I try and cope with it, and that really wasn't an option.
Okay, so a little scratch coming up.
Using an ultrasound to guide the needle, radiologist Dimitri starts by administering an anaesthetic to help numb the area.
Let me know how you're feeling. Sorry.
I don't want to have to rely on anybody else for anything. I just want to be able to get on and, you know, live my own life and be independent again.
So now we're going to put the steroid in.
A second syringe is needed to inject the steroid and some saline to stretch the joint capsule.
I can see you're under a lot of pressure in that joint. The fluid's coming out as we're putting it in.
Despite the anaesthetic, with so much pressure in her shoulder, the procedure is extremely painful. Trudy must keep still or she risks pushing the needle and the steroid out of place.
Okay, so now we're going to try and put some fluid into the joint. This may hurt. Just tell me what you can tolerate. Don't be brave. You okay? I'll let off some of the pressure there.
Doing so well.
Well, there's no doubt you've got a frozen shoulder.
Doing so well.
Once administered, the saline will expand the capsule of Trudy's shoulder, stretching out the tissue and loosening the joint.
Still sore. Okay. Well, look, I think that's really good. We've got in some local anaesthetic, we've got into a steroid, and we've managed to stretch the capsule as much as we can. So we're going to stop there. I don't want to cause you any more pain.
But this won't be an instant cure.
You've got a very tight capsule, as we thought from the scan, and the steroid in there is going to start working. It's going to start easing up in the next couple of days, but it is going to feel a little bit tight at the moment, I'm afraid. And then you may feel that it kind of twinges during the day, and you feel a pop, and that is actually some of the fluid escaping because it's so tight.
So that's good, essentially.
Yeah, exactly.
Right. Okay, so if you hear a pop, it's not.
Yeah.
It's a good thing. It's a good thing.
Just be careful as you sit up, yeah.
Over the coming weeks, Trudy will have further injections and a course of physio to stretch the joint more and hopefully over time return it to its normal, flexible, pain-free state.
You're looking better already. You are. You went so white. I was terrified. Oh, you couldn't even see it, Dimitri.
No, I couldn't, no.
You were at the action end, I was at the emotional end.
At St Mary's Hospital in London, it's the day of Hilda's operation.
I'm very hopeful that's going to go well. So, yeah, I'm looking forward to it. I just want to get over it, you know, and move on with life.
Having discovered at our imaging centre how serious her case of fibroids has become, she's decided that surgery to remove the growths is the best option.
Hopefully, by the end of today, I'll be fibroids free.
The doctor in charge of Hilda's procedure is Mr. Quinn.
Having the 3D consultation before the surgery has been very, very helpful. It's allowed myself to look at all the position of the fibroids, so I've got a very clear idea of exactly what's required in terms of the number of fibroids that we remove. Obviously, we have to do that safely, and we might not be able to get every fibroid, but we're going to do our very best to do as much as we can and try and restore as much of Hilda's normal uterus as we can today. How are we doing, guys? We all set? Yeah. Fantastic.
Mr. Quinn has a big task ahead of him. Our imaging centre revealed more than 90 fibroids spread throughout Hilda's uterus.
It is a very complicated operation for a number of reasons. Firstly, simply the number of fibroids that Hilda has and the size and the location of the fibroids.
She wants Mr. Quinn to preserve her fertility, so each growth has to be removed individually.
And we're going to be making our midline incision in this area here.
But it's not straightforward.
Going into this operation, I do understand that there is a risk of a hysterectomy based on the number of fibroids that are growing within me. The doctors can only try to do their best.
Before Mr. Quinn can remove the fibroids, he needs to lift Hilda's uterus out of her abdomen so he can see what he's doing.
Can I have a table up just a touch, please? Lovely, thank you very much.
It has to be taken out extremely carefully to avoid damaging any of the surrounding organs.
So we've been able to open Hilda's abdomen and we've been able to deliver the uterus through the abdominal incision. And you can see here very clearly all the different fibroids. You can see these subsequent fibroids we saw in the imaging, which is sitting at the top of the uterus. Here again, side. Within the rest of this uterus, they're going to be the deeper fibroids and obviously the fibroids on the inside. So what we're going to do in a moment is now start to make an incision into the uterus to remove as many of these fibroids as we can safely. So the big risk is blood loss. We have blood cross-matched and we're going to be very meticulous with our control of the blood loss during the operation.
The sheer number of fibroids means hemorrhaging is still a real danger. If that happens, a full hysterectomy may be the only option.
Happy with that at the moment, that's absolutely fine.
After 3.5 hours, Hilda's surgery is finally over, and Mr. Quinn has even found some additional fibroids that didn't show up before.
So it's gone very well. We've removed 100 fibroids.
The 100 fibroids Mr. Quinn has taken out weigh more than 2 kilograms, ranging in size from 12 centimetres across to just a few millimetres.
Getting those tiny fibroids out's really important because over the next 10 years of Hilda's life, those tiny fibroids that are left behind could then grow into much larger fibroids. So that's why we really wanted to get every single fibroid we could find.
And incredible news for Hilda, Mr. Quinn was able to save her uterus.
The womb is intact and there was blood loss, but we've managed to manage that very well. So yes, we're very pleased with how it's gone. Hilda has a now much more normal-sized uterus, her tummy's nice and flat, and we're hoping that her symptoms are going to be much, much better. So this has been a very positive, very good morning.
It's been 4 months since Trudy was treated for her debilitating frozen shoulder.
Since my last injection, I've been doing physio on a weekly basis, daily at home and at work, and it seems to be working. I do feel positive about the future. I can see the change. No shell. Way, done it properly. God, that's so much easier than before. It's been a great help with the grandchildren because I'm able to do so much more with them. I think they're pleased that they don't have to come running every 2 minutes to pick everything up and move stuff for me. I'm actually using my arm a lot better now, aren't I? Because before I could never have done this. Couldn't have even picked up this bowl. Makes such a difference, doesn't it?
Yeah.
It was a real role reversal before. Now it's really nice to be able to get back to being Nan. If I hold the bowl, do you want to be able to put some in?
The increased mobility in Trudy's arms means she can lift and hold objects again. She's back at work, and with daily physio, things should keep on improving, so she gets to hug her grandkids again.
I can see Nan's arm getting better every day. It's like a lot easier because she can do it all for me now.
I've just got to be grateful that now I'm able to actually use my arm a lot more than it was before. Still not there, but I am getting there, which is great news. That's it, done?
Yeah. Mine.
At our imaging centre, fashion influencer Hilda came face to face with more than 90 fibroids in her womb that were pushing out her tummy, leaving her exhausted and in crippling pain.
You know, the graphic reality of what is sitting inside my belly is shocking. Having seen the normal one and compare, it's like an inflated balloon. It's enormous.
All of them are great.
It's now been 6 weeks since her operation.
Look at that!
And just look at her.
Amazing! That is so gorgeous.
I'm feeling alive again. You know, I'm no longer tired from anemia and all of that. I'm looking forward to speaking with my consultant just so he can tell me what's going on inside. So I'm waiting for that moment because it's just like the icing on the cake.
Today, Hilda has come to see Mr. Stephen Quinn, her gynecologist.
Oh, hello.
Hello, Dr. Guddi.
Hilda, it's so nice to see you.
And Dr. Guddi is there too for moral support.
Knock, knock. Hello.
Come in. Good afternoon.
Hello, Mr. Quinn.
Hi, Hilda. Lovely to see you.
Thank you.
How have you been doing, Hilda?
I've been doing really well, thank you.
It's a big operation, very successful operation. We're really pleased that we were able to do everything that we said we were going to do.
Yeah.
All those fibroids that we saw before the surgery, we were able to remove all of those safely. We were able to do that without damaging the womb, which we're really pleased about. That was the big thing that we were concerned about. And I know this has been a hard period of time for you in terms of the recovery, but I think you've done amazingly well, so I'm very, very pleased.
I cannot thank you enough because hearing you say my uterus is still intact is just what I wanted to confirm, because the first voice I heard while I was in recovery was your voice. And there was this joy in your voice. You said, Hilda, your surgery went really well. And I was just filled with joy, even though I was in pain. I'm so thankful for the care that you and your medical team, without you, I wouldn't be here today.
Oh.
We saw how many there were inside, but how many were you actually able to take out?
And when we did the surgery, we actually removed 100.
What?
Some of the fibroids were really very small, all the way up to some of the fibroids being extremely large, and the amount of tissue that we removed was over 2 kilograms. So that was a loss of an awful lot of tissue that's come away.
There's one thing that still bothers me, you know. Will this come back in the future?
There is that possibility. We can never 100% say there's no chance of fibroids coming back. What we have to do is to make sure that this is managed.
How soon can I start making babies? I know that's the crude way to put it out to you.
Because of the nature of the surgery that you had, I would say 6 months, really, because we really want your uterus to be as well healed as possible.
100 fibroids is not 10 fibroids, and I've got my life, so thank you.
You've done incredibly well, and I think a lot of this comes down to you and your attitude and how positive you've been.
I feel a lot more confident. I'm really glad that I'm out here today just rocking this toggle outfit. It goes without saying that, you know, I'm happy and that joy is from inside.